Yes, we have a quorum. So, Chief Lamborg, if you'd like to call the meeting to order, then we can do the official attendance and roll call.
Hey, good morning, everyone. I'd like to call the November 9th Emergency Medical Care Committee meeting to order. And Steve, can we have an official roll call?
Yes. Just a moment to get back to that. All right, official roll call. Will Hiller.
Here.
Tina Nieto. No, she's absent. Sam Klamick.
Here.
Perfect. Jim Lamborg.
Here.
Harry Robbins.
Here.
Jody Schaefer.
Here.
Let's see. Noah Hawthorne.
Here.
John Anthony. All right, Carla Spencer.
Here.
Then we have Paul Wood and Luz Garcia.
Here.
Thank you. All right. Alternates, Mike Esslinger.
Here, sorry about that.
Okay, Roger Reinhardt,
I'm here.
Cheryl Getz.
I'm here.
Perfect. Ben Harvey. Noah, I'm sorry, Dr. Hawthorne, we got you. Joe Cafaro.
Here.
Thank you. Keith Boyd. Andy Smith. Ex officio, Teresa Rios. I saw her up there.
Here.
Okay, very good. Leanna Goski.
Here.
Gary Millay. And then we'll introduce EMS agency staff in the room. Jesse Allard.
Kimberly Hernandez.
Deborah Hopgood.
Blake Anderson.
Steve Brooks. Karina. Just say Karina.
Karina Moreno.
Very good. All right, that's EMS agency staff. Any other EMS agency staff online? I don't think there are.
Keith Boyd from King City representing the law chiefs. I got on a little bit late.
Wonderful. Thank you for joining us. Okay, any other members of the public who would like to introduce themselves?
Dr. Burley, I'm also on.
Thank you.
Ben Hitchcock. Sorry. Ben Hitchcock, AMRCES.
Okay, thank you.
Reb close
Right
with
now.
top and prescribe safe.
I got Rep Close. Thank you.
Ryan Alexander, Salinas Fire.
Thank you.
Jeff Model Program Director, Telstar.
Thank you, Jeff.
Sandra Flores, AMR Communications.
Thank you, Sandra.
Michelle Kalinsky Chomp.
Thank you.
Rachel Nealand, AMRCS.
Got it. Thank you.
Justin Reyes, Monterey County Regional Fire.
Thank you.
Matt Everett, Salinas Fire.
Great. Thank you.
Calvin's Panholzer, Monterey Fire.
Thank you. Anyone else like to announce their presence? Great. Thank you very much. We do have a quorum.
Excellent. Very good. Let's move on to public comment. Is there any public comment? Okay, well, I will take that as a no. Next, approval of past EMCC meeting minutes. We have both the September 4th, 2022 and the October 12th, 2022. Hopefully everyone has had a chance to review those. Okay, any discussion?
I move approval of both minutes of both meetings.
Very good. We have a second.
I second, Jim.
Excellent.
Good catch,
Carla.
Carla. Carla, I think we still have, oh, did we get your oath?
Yeah, Carla did.
Yes, we did. Okay, very good. Thank you, Carla.
Okay, Steve, can we get a roll call?
Roll call vote. Barry Robbins,
Aye.
Roger Reinhardt. Let's see, Jim Limborg,
Aye.
Jody Schaefer,
Aye.
Will Hiller,
Aye.
Carla Spencer,
Aye.
Sam Clemic,
Aye.
Paul Hawthorne.
Aye.
Keith Boyd.
Aye.
Very good, thank you.
Very good. Moving on to reports, Medical Advisory Subcommittee.
Yeah, I will take that report on the CQI tag program. There is a written report included in your agenda packet to highlight a couple items. The STEMI stroke and CQI tag committees all met within the last month or so. The STEMI and stroke groups were able to review follow-up data from the Get With The Guidelines program for the first time. So that was very instructive and useful and will inform some of our activities on the go forward. On the trauma side of things, Natividad recently completed their re-verification site visit with the American College of Surgeons. The EMS agency participated throughout that review, and Natividad received great feedback from that in their initial follow-up meeting. Otherwise, the CQI tag committee itself is beginning a project to look at resuscitation and cardiac arrest treatment and management. And if there are no questions, that's the end of my report.
Very good. Any questions?
I saw it. I didn't. Yeah, this is Chief Boyd. I just want to make a comment if that's possible.
Yep, go ahead.
I just want to thank EMS for that report on Natividad. And again, that's a wonderful accomplishment for our community and our county to have an ACS verified level 2 trauma center, not only for our residents of our community, but for our public safety and our firefighters and such. To have that resource is a huge benefit to our community, and I have great appreciation and want to extend my thanks to Natividad and EMS.
Very good, and I concur with that. Any other comments? Okay, moving on to the Operations Subcommittee. It looks like Blake Anderson has that report.
Good morning. Let me pull up really quick. Operations Subcommittee notes.
You can just tell them it was included in the agenda.
Yeah. So Operations Subcommittee notes is included in the agenda packet.
So the operations subcommittee minutes are included in the agenda packet. Blake, we're transitioning from myself to Blake managing the operations subcommittee. Does anyone have any questions on the minutes?
No.
Thank you.
Okay, thank you. Moving on to the Mohawk, Deborah.
Yes, again, there is a written report included in your agenda packet. Since the time of that report, there have been no significant changes in either the COVID or MPOX data. There is a note on there regarding the end of the state of emergency, which Governor Newsom has announced will be effective February 28th. The EMS agency and the health department in general are in the process of reviewing our current policies, procedures, operations to see what impacts the end of that state emergency will have, and we'll provide more updates as we complete that review. For those who are requesting either PPE or testing supplies from the Mohawk still, there will be a limitation on supply availability for pickup. The pickup hours themselves, as the EOC kind of cuts down the amount of resources that are dedicated to the logistics branch. So we'll be putting out information on that Otherwise, I don't have any further updates to relay. I'm happy to answer any questions if there are any.
Very good. Any questions? Just a quick comment by myself. I'm happy to see the COVID emergency go away. I think I speak for everybody when I say that. Well, I shouldn't say go away, but at least scale down significantly. Okay, moving on to EMS system performance metrics.
Chief Flamborg?
Yes.
We may have missed item C there.
EMS agency.
Oh,
director report.
I certainly did. Sorry about that, Teresa. I'm gonna get on your
That's
bad
okay.
side. Do you have?
Thank you, Chief. There's also a staff report included in the agenda packet. Provides highlights with some of the projects that we are working on. There are some new ones. You will note that there are a couple of projects that we are going to be putting in the back burner. I believe there's a more detailed report later. It's just it's been difficult to move forward a couple of projects, and given all the competing priorities, I think the agency needed to reassess where we needed to put our efforts at this time. But you know, I believe Deborah has an update on those, more detailed update on those. And if you have any questions on any of the items on my report, I'll be happy to answer them.
Any questions? Okay, I'll take that. Thank you, Teresa. I appreciate that, and sorry about missing you then. EMS system performance metrics. We'll start with communications. Kimberly.
Okay, so I'm going to go ahead and roll through A, B, and C if that's okay, because those are all mine. Communications testing, the 800 megahertz radio testing and the ReadyNet drill reports are included in the agenda packet. Nothing much to note there, or no new updates. We continue to report those out to the hospitals monthly. Any questions on either of those reports? Okay, so I'll move into contract compliance working group. There was a response time compliance and MPDS PowerPoint included in the agenda packet. For response time compliance, all priorities met or exceeded 90% compliance with 2 exceptions. Priority 6 for August was at 85%. I do want to say that's for overall response time compliance. It was at 85%. And the 100 call rule does not apply to the overall. So I just want to interpret that with caution. The call volume was very low. It was under 25 calls. So it looks low, but unfortunately due to what's in the prescribed in the agreement, the 100 call rule doesn't apply to the overall compliance. The next would be priority 1 in September was at 88%. So those are the highlights from the report. Does anyone have any questions? All right, then I'm going to roll into fire-based transport provider report. The PowerPoint was included in the agenda packet. We wanted to discuss, so previously the PowerPoint has been included in the agenda packet. It's a little lengthy. We wanted to change the format to a more summarized report where you would still see the charts, but it would be just kind of compacted into 2 pages, unless anyone has any objections to that. And does anyone have any questions on the report, the other provider report? Okay, so sorry, go ahead. Oh, in the future, you'll see the more summarized report. So we'll replace the PowerPoint with the summarized. Thank you.
Thank you very much. Appreciate that, Kimberly. Moving on, we'll go into old business and EMCC membership. Steve Brooks.
Yes, as you can tell, we're still working on getting a couple members reappointed, getting their oath of office done. Of course, any members who have not completed the other requirements, the Form 700, those still need to be completed also, but it isn't required to get you seated on the committee and able to vote. The other issue is that the Board of Supervisors has altered their requirements for the appointment process. As you guys all know, this is a board-appointed position, and they would like to know a little bit about the members who are being appointed. So we will be needing a resume for all members when it comes time for reappointments. So don't be surprised if we ask for the CV or resume. You can give us your regular one, an abbreviated one, whatever you'd like to do, but we will need that to include with the application for reappointment. That's what I got.
Thank you. Okay, moving on to new business, and try and dust off some of my recovering paramedic skills here and pronounce this, but buprenorphine, did I say that, or buprenorphine, narcotic overdose prevention? Jesse?
Close enough, Chief. You can just call it BUP if you want.
I like that.
It's called BUP, yep. I'm excited to discuss this PowerPoint. If you, this was included in the agenda packet, but if you click on the little QR code, you can follow along on your phone or tablet as we present. This is a Tri-County project. We came to the Dr. Close, Dr. Hearn, Dr. Burley, Dr. Gilladucci came to this group. I think it was last meeting a few months ago. And what we're hoping to do is get the EMCC's endorsement today on this project. We'd like to give a little bit of an update between Dr. Close and I. Next slide, please. So just kind of a quick update where we are. This was originally slated as a pilot project. Since then, the state has said we're going to allow this as a LOSOP, a local optional scope of practice items for counties who wish to apply. We were really kind of Johnny on the spot. We were one of the first LEMSAs to apply. And since then, there's been about 15 other EMS agencies behind us applying to the state to utilize this drug, which is a great thing statewide. Certainly, there's some momentum behind it. And I think that's a lot to do with Dr. Close and Dr. Hearn. We created an aim to be real specific, process measure and outcome measure. Some of this was really over the top for a LOSOP, but again, this started out as a pilot project. So we really spent some time putting some project management behind it. We've created some committees, and we have a slide on that, and set a timeline for implementation. And the biggest kind of hurdle is we're excited again to kind of get our large packet off to the state and be one of the first to do so. That has been beneficial for this project because the CDPH reached out to our group and identified some potential grant funding for the next couple of years, Tri-County wide, to help support this project, which is a great thing here locally for our county. We've also developed a draft treatment guideline, which we anticipate using when we go live. Next slide, please. As far as our aim, I'll focus on what's in orange. This is really our outcome measure. What we hope to do when this is all said and done is of those patients who we encounter who are eligible to receive buprenorphine treatment and be linked to substance abuse navigator providers, we'd like to see at least 80% compliance. This is a really lofty goal, but we're going to shoot high and hopefully get somewhere close to that. Next slide, please. Here's a picture of it, what the drug looks like. Some people say it looks like a little Listerine tab. Maybe you put on your tongue. This is a sublingual film. It's fairly small. And if you go to the next slide, Rachel, can you go one more slide? And one more, sorry. This is our Vanna White, Rachel Nealand, who is kind enough to show her awesome manicure. This is a current drug box that AMR uses now. This has ketamine, morphine, fentanyl, Versed. And so we're even having conversations of where to put yet another narcotic. So it's exciting, but we're having conversations all along the way. If you wouldn't mind just going back to, sorry, just back to
Where we were at.
one more and one more. Thank you. We've created a committee structure. We have a community consortium. And again, this is a tri-county project. This community consortium meets every 6 weeks. The lion's share of the work really occurs in the steering committee. Several of you on this meeting are involved in that. We meet every 2 weeks. And then, of course, we're not trying to create committees, just have committees, but when we identify work such as SUN or some data analytics or even financial aspects, those groups meet either ad hoc or every 6 weeks. Next slide, please. This is our timeline just over the next few months. We're right on track. We're hoping to implement this project on April 1st of next year. Certainly that's contingent on approval by the state and also us kind of getting some of our data sharing agreements, MOUs, and working through some of the tri-county logistics. Next slide, please. We're releasing a memo today that's discussing buprenorphine was a part of this packet. Right now, we're starting with AMR only for about the next year. We'd really like the opportunity to appreciate impact of this project, to appreciate cost, to identify the end number, how many patients we're encountering, and kind of work out some of those kinks before we open this up to other ALS transport providers, which we anticipate doing. There is even discussion about opening this up to all medics countywide, but we'd like to just reserve that as we get going in this project a little bit further. And next slide. And I'll kick it over to Dr. Close. She's really been kind of championing this project and probably should have been presenting, but if you have anything else to add, Dr. Close.
Yeah, I just want to say thank you for the organization and for the support and the fact that we are able to move this forward as a tri-county collaborative. And because we pulled together so quickly, and of course with Jesse having everything so well aligned, we were able to make ourselves eligible for CDPH funding for this. We'll find out on that shortly. It'll cover the cost for the next 2 years regarding the training and administration. So we've even been looking in that regard. And as I mentioned in the last meeting, I met with Elsa Jimenez this week. We were talking about this as one of many of the projects that are moving forward in our community. And she was obviously very much in support of this collaboration and this work. If there's any questions, that's why I'm here as well. And I'm just super excited to be able to move this forward. We were chatting with one of the providers on the last meeting, and really this is treating the suffering of substance or of opiate withdrawal and helping connect all those patients to treatment. Dr. Giarducci and I have been working with Santa Cruz and San Benito to make sure that all of the hospitals are equipped to help these patients move forward towards their journey of treatment. So just thank you so much for having me here, and I am really grateful to answer any questions that I can.
And Chief, we're hoping that this group would consider endorsing this project, certainly from a tri-county perspective. Other counties are moving forward, but just as a formality, and because there was, I think Harry even in particular was really excited about the presentation a few months ago, we just thought it was prudent to come back to this group for discussion and potential endorsement.
Okay, let me just real quick, Harry, let me ask Steve a quick question. Is that something that we could just make a motion on to endorse, or is that something we'd have to come back for on a separate agenda item?
We have listed as an action item, as this committee asked to have this come back is something that the committee could support. So if you would like to, if one of the members of the committee would like to make a motion to state that EMCC is in support of this project, that's within the purview of this committee.
Chief, I'd like to make a motion on this issue.
Okay.
And the motion is?
Motion is that the EMCC endorse this program, its goals and objectives. And I cannot be any more laudatory than that, but and express its appreciation to those who have guided this program to its start. My only regret is that we can't be equally as aggressive as stopping off the source of supply that caused this problem. But hopefully that will come too. But I strongly recommend that we endorse this program as stated in its goals and objectives.
I'm happy to second that.
Thank you. Got a first from Harry and a second from Jody.
Any discussion? Okay. Steve, get a roll call, please.
Roll call. Stand by 1. Actually, I'll just do it this way. Harry Robbins,
Aye.
Jim Limborg,
Aye.
Jody Schaefer,
Aye.
let's see, Will Hiller,
Aye.
Carlos Spencer, Carla, Sam Clement, there's Sam. Noah Hawthorne.
Aye.
Keith Boyd.
Aye.
Back to Sam Clemic, support for the motion.
Aye.
And Carla Spencer. I think we may have lost Carla, but we do have enough to carry this.
Excellent, very good. And want to second what Harry said there and appreciate the great work. And I think it's important that this problem on a national level is handled with a multi-pronged approach, and this certainly seems to be doing just that. So again, thank you. Moving on to the AHA GWTG status of database for stroke and STEMI. Steve Brooks.
Yes, the EMS agency is very pleased to let you guys know that the AHA Get With The Guidelines database has been useful as we've developed data for our, as Deborah had mentioned earlier, for our stroke and STEMI QI program. We've gave just a very basic level reports there, and there's much more data we can start mining to look at the health of our STEMI and stroke systems within our total EMS system of care. So quite a bit to come in the future, and look forward to sharing with you more of how we use this database.
Excellent. Any questions? Okay, very good. Moving on to CSA 74 fund disbursement. Teresa, didn't forget you this time.
Hi, this is Karina, and I'll be giving the report. In your packets, you would have had the CSA 74 allocations for fiscal year 22-23. The calculations were based on an established formula and will be dispersed in December. Also in your agenda packets, you will find a year-to-date comparison. That's the report.
A correction. I couldn't quite hear all that, but I think you stated it's in our package. I did not have any of the CSA distribution, CSA 74 distribution in my packet, what I received.
Did you send out the?
Give me a second to confirm, because we did send out an initial packet that did not include the CSA 74, and then we sent out a subsequent updated packet with the CSA 74.
Okay, I may not have received that one, but whatever. Okay.
We can email it to you.
And we'll certainly email it to you, Harry.
Please.
Yep, and yep, I just kind of looking at mine. So yeah, you sent out two packets, didn't you, Steve?
Yes, I did.
The later one. So yes, see. Okay, any other questions or comments? Very good. Moving on to EMCC bylaws refresh. Steve.
Goodness, caught me. Well, I was trying to sneak in something for Harry. Give me just a moment here to get to my notes. All right, so with the EMCC bylaw refresh, you'll find in your packet a copy of what was distributed for the policy and protocol update, and you'll notice that the EMS committee's policy looks like it was more blown up than polished with a brush. And that is because we have committees, subcommittees of MAC and OPS that are considered Brown Act committees, adds that layer of complexity to them. And they initially were advisory committees to the EMS medical director and the EMS agency. So we're looking to change how they function, within the bylaws. The bylaws have, for EMCC, were approved by the Board of Supervisors, and with our policies changes, there is some compliance issues as far as they're not necessarily lined up well anymore. So we're blowing the whole thing up and creating what should be a more streamlined structure for reporting, as well as how the committees can be formed and make a better process all around. EMCC, again, is a committee that are using under Health and Safety Code, and as a board appointed committee will have, very much prominence in this, because let's face it, it's useful and helps us, as we look at our system. So with that, any questions about the update and refresh for the bylaws? And policy, of course.
No, and appreciate that. And yeah, I can see there's definitely a lot of work being put into that. And I know that for me, it's since I've been on, it's trying to figure out exactly what we do. Has trying to dial that in has been a little bit of a challenge for me. And this is certainly going to help. I appreciate your work on that, Steve. Okay, any other questions or comments? Okay, Fort Hunter Liggett Fire Department change in service levels. Deborah.
Yes, just as a reminder, Fort Hunter Liggett approached us a couple months ago regarding a change in service levels that they'll be going to with a switch to a military-based medical direction. We've been working on a draft agreement to put in place with them. We're required to change that based on their change in service levels. Our draft has been completed. It came back from County Council this week. We're making a couple modifications based on that, and we'll be forwarding that on to Fort Hunter Liggett shortly for their review as well.
Are there any significant changes in the coverage or in the levels of care?
They have several new procedures and medications, such as whole blood, chest tubes. Those are the first two that pop to mind that they're putting in place because of their status as a primary military provider. We anticipate, and part of the reason that we're working on this agreement is that they would like to continue to be able to provide mutual aid response within the county, which makes it necessary to put this in place for those responses.
That's the thrust of my question.
Yeah.
Will that improve coverage off the base?
It will certainly allow them to continue their current response and current assistance. So without the agreement, that would be more challenging to do. So we're making sure, putting this in place to allow them to continue doing that.
Thank you. Thank you.
Deborah, I have a quick question just for confirmation. I think this is what I understand, but with that expanded scope of practice that they have, like the chest tubes, is when they respond mutual and auto aid off base, would that scope of practice extend into those areas, or are they then confined to the Monterey County scope of practice?
The agreement is currently drafted, which obviously hasn't been signed or put in place. So with that caveat, would allow them to operate under the same scope of practice and the same scope of protocols, both on the military installation and off base as well. I think a similar mindset to the unified scope of practice that we put in place for our helicopter paramedics, so that we're not forcing those Fort Hunter Liggett paramedics to have two sets of protocols in their mind and make the distinction between where they've responded to and which care they need to provide.
Well, thank you. Appreciate that. Any other questions? Okay, paramedic training program status. Steve.
Yes, we are pleased to report that EMS agency staff participated in a meeting with the paramedic training program personnel for their advisory body to hear how the program is progressing. They have 15 students, which is great, and they haven't lost any, which speaks to the dedication of the students and the commitment of their employers. They're pretty much almost all sponsored students, so they have great incentive to continue on in the program because they've got an employer who's sponsoring them and helping them get through, with time off from work, things like that. From the program director, the students are doing very well. They're very highly motivated and exceeding expectations in performance. Listening to the report, they also are challenging the instructors in areas where they feel that they're maybe not getting quite the material they were looking for. And so it's really quite a good program seeming to come through. We'll see how they all test out, but the early reports are good. They have agreements in place to place all of them for their hospital clinical rotation as well as for field rotation. They believe they'll have places for all of them to at least do part of their field internship on transport providers, because that's crucial to meet requirements. So it's moving forward well with the current cohort. The new news is that there's interest in a second cohort, and they'll are aiming towards a second cohort starting early next year. So lots of good things happening with the paramedic training program. It's based on the number of paramedics coming into the industry versus those who are leaving. We need this pipeline to keep the staffing up. If there's any questions.
Very good. And Steve, is that construction sound? Is that coming from your location or is that somebody else?
I think it's large rodents in the wall or are building their little condominiums. We assume that there's something going on maintenance wise on the other side.
Okay, wasn't sure if someone had an open mic. I didn't see one, but just making sure. Okay, appreciate that. And Monterey County Emergency Medical Services Ordinance Revision. Deborah.
Yes, just a brief update since we presented this for the first time at the last meeting. The EMS agency has completed a first draft of our proposed revisions to the EMS ordinance that is currently in the process of being reviewed alongside County Council. And once that review is done and we have a second draft, we anticipate bringing that to our stakeholders and seeking your input and feedback. So more to come in the future as that draft is wrapped up.
Very good. Any questions? Okay, moving on to HAB 361, report on requirements. Steve.
All right, there's a couple of things here. If we've been enjoying meeting remotely that we've been able to do under AB 361 guidance. We need to do a couple of things at this meeting. First, we need to find that the conditions that enable us to meet under AB 361 continue to exist, such as there's still a state of emergency and it's, there's good reason, health reasons to continue to meet remotely. So we'll need a motion for that so we can continue to meet under AB 361. Then, because EMCC won't be meeting again until January, we'll be looking for a meeting in between. And so the EMS agency staff is proposing December 7th, 2022. And then, as Deborah mentioned, Governor Newsom has announced that there will be an end to the state of emergency. He made the announcement on October 17th to be effective February 28th, 2023. And we're still in process to figure out how this is going to impact our ability to meet remotely and not have it considered as under current Brown Act rules, a meeting location where the public can attend. So if there's any questions, happy to answer questions. Otherwise, I suspect we'll be looking for a motion to find that the conditions still exist and we can meet remotely under AB 361.
I make a motion that that the conditions still exist and we continue to meet under AB 361 until the official lifting of the COVID emergency on the 28th of February next year.
Excellent. We have a second.
Keith Boyd.
Okay. Very good. We have a motion and a second. Steve, can we get a roll call?
Yes, Harry Robbins.
Aye.
Jim Limborg.
Aye.
Jody Schaefer.
Aye.
Will Hiller,
Aye.
Carla Spencer,
Aye.
Sam Clemic,
Aye.
Noah Hawthorne,
Aye.
Keith Boyd.
Aye.
Very good. Thank you.
Excellent. Announcements and good of the order.
Chief, I'd like to say one thing in addition to the motion on AB 361, the vote. I know that everyone here has very intense commitments in their professional lives. And the ability to meet via Zoom, or the option to meet via Zoom, at least in some cases, greatly facilitates their day. When people have to travel from the peninsula or from King City or from elsewhere around the county, there's a transit time involved, and that can be dead time for the professionally. I would like to see, if at all possible, we can continue to have that option for those who might use that option to their advantage to continue to meet via Zoom after the emergency is lifted. I think we should consider that if it is legal and acceptable under the current Brown Act standards. I'll just leave it out there, and I would endorse that EMSA continue to investigate the possibilities of employing that.
Harry, I agree with that. Steve, has that been discussed? And if so, has legal counsel had any advice on that?
It's been a little bit, but county council is working with other councils and coming up with what may be a solution. So we're hopeful. We would, like to entertain being able to have members meet remotely without it being considered a public meeting space.
I would recommend we bring that back in January for further discussion and/or implementation.
Thank you.
Anything else? Okay, moving on to announcements and for the good of the order. Just do a round table. You got anything, Harry?
Nope. Nope.
Okay, we always got such good stuff. Anybody else?
This is Will Hiller from AMR. I just wanted to comment on the Butte process and the Butte program. Just thanking everybody here for endorsing it, and from our perspective, we're happy to be partners in this system, and just very happy to be part of it. We're definitely looking forward to working with the agency to get this moving forward as quickly as possible. So thank you all for your help with that.
Excellent. Okay, and just real quick, I have a couple of things. First, I'd like to mention that in October, we were fortunate enough to bring on a deputy fire chief to assist me, which I'm very grateful for. His name is Tyler Kiesling. He worked for Monterey Fire, and then he had also worked for Greenfield for a couple of years as well prior to that. So he's on board now, and you're going to be seeing him at some meetings, and he's been given the direction to certainly embrace the EMS side of what we do. So you'll be seeing him out there. And then the other thing, hopefully this is appropriate, but I would like to congratulate what appears to be our new sheriff, Tina Nieto. And it looks like she's had a decisive decision. Obviously, the election hasn't been certified yet, but it's looking pretty good that way. And with that, if there aren't any other questions, we'll move it on to or comments, move it on to the next meeting, which is scheduled. Our next regular meeting is January 11th, but I think we also discussed having a December 7th special meeting for the AB 361.
That is correct.
Okay. And with that, I'd like to make a motion for adjournment.
So moved.
Second. Okay.
So I missed the second. Was that Will?
No, that was Chief Clemic.
Oh, Sam. Thank you very much.
Okay. And I don't think we need a roll call on that. I would imagine we're all in favor of adjourning. So we'll see you out there. Thank you.
Good meeting, chief. And
Thank you.
staff.
Thank you
And
all.
staff.
Thank you all.